ethnicity, and social class have a strong impact on our health. Yet the simple fact is that no one is just a man or woman, or just black or white, or just working class or middle class. But instead, we have multiple characteristics that shape our lives. Instead, imagine a population represented on a grid. About half the population is female, half male, and some non-binary. And say 80% are white, and 20% are minority ethnic, and these groups have different social class backgrounds. Now we can ask, do these different resulting subgroups have different levels of health and disease? And if so, how can we explain these differences? Enter a perspective called intersectionality. Kimberly Crenshaw coined the term to describe the discrimination experienced by black women. She gave the example of a lawsuit against General Motors for not hiring black women. The company hired women and black people, but did not hire black women in particular. Crenshaw showed how sexism and racism combine to create a distinct type of disadvantage. This could be extended to other types of isms, such as ageism, disableism, and classism. Together, these different types of discrimination result in varying forms of advantage and disadvantage, which can lead to differences in health. To understand why discrimination is important for health, it's useful to think of the role of social institutions such as schools, hospitals, or the legal system. These institutions control who enters them and the experiences that they have there. Working-class children are underrepresented among university students, and black men are overrepresented in prison. Discrimination in the criminal justice system, the education system, and in society more widely is a key reason why we see such differences. In fact, any social institution, like employment or housing, can unfairly discriminate on the basis of multiple social characteristics. We know that social institutions are key determinants of health, and this helps to explain health differences based on gender, ethnicity, and other social characteristics. However, we do need to be careful and remember that people are hugely diverse. For example, white middle-class men are on average healthier than, say, black working-class women, but there is still lots of overlap between these two groups. This overlap is also important to keep in mind because experiences of sexism can unite all women, regardless of their ethnicity and social background. Racism, ageism, and other isms can also unite people to bring about social change. Yet, as Crenshaw showed, if we do not consider intersectionality, we may miss how interlocking forms of discrimination create new inequalities. So far, researchers and public health professionals have paid little attention to intersectionality.